Hey everyone, let's dive a little deeper into two of the most hardworking yet often overlooked organs in your body, your kidneys. They're like those silent, loyal friends who are always there in the background, working 24/7 without complaining, filtering your blood, balancing your fluids, and keeping everything in check. But what happens when these dependable buddies start to struggle under the pressure? That's where chronic kidney disease, or CKD, sneaks into the picture. And let me tell you, it's way more common and way sneakier than most people realize. In fact, millions of folks around the world are living with it right now, many without even knowing. So let's break down what exactly CKD is, because understanding it is the first step to taking control. It's not some sudden catastrophe that hits you out of nowhere. Nope. It's a gradual, slow-motion decline in kidney function that unfolds over at least 3 months, sometimes years. Imagine your kidneys as a high-tech filtration system in a fancy water purifier. Over time, if it's not maintained, the filters get clogged and less efficient. Doctors diagnose and track this with a key metric called the glomerular filtration rate, or GFR, which essentially measures how well your kidneys are cleaning your blood. A normal GFR is above 90 milliliters per minute, but as CKD progresses, it dips lower. They also check for protein in your urine through tests like the albumin to creatinine ratio, because healthy kidneys act like a fine sieve that keeps important proteins in your blood while letting waste out. When that sieve gets damaged, proteins start slipping through, which is a big red flag. Now you might be curious about the root causes. Why do our kidneys end up in this bind? The two biggest villains by far are diabetes and high blood pressure, acting like relentless bullies that wear down the kidneys over time. With diabetes, consistently high blood sugar levels can inflame and scar the tiny blood vessels in the kidneys, making it harder for them to filter properly. High blood pressure, on the other hand, is like forcing water through pipes at too high a pressure. It strains and damages the delicate structures inside. But that's not all. There are other culprits too. Genetic conditions such as polycystic kidney disease, where fluid-filled cysts grow and crowd out healthy tissue, can be inherited and show up later in life. Recurring urinary tract infections, or kidney infections, can cause lasting damage if not treated promptly. Even certain medications we take for granted, like over-the-counter pain relievers such as NSAIDs, think ibuprofen or naproxen, can harm the kidneys if used excessively, especially if you already have risk factors. Autoimmune diseases like lupus can attack the kidneys directly, and blockages from kidney stones or enlarged prostates in men can back up the system. Environmental factors like exposure to heavy metals or certain toxins play a role in some cases too. It's a reminder that our bodies are interconnected. Issues in one area can ripple out to affect these vital organs. Here's where CKD gets really tricky. It's often a silent operator in its early stages, earning it the nickname the silent killer in kidney health circles. Your kidneys are absolute champs at compensating. They can lose up to 75% of their function before you even notice something's off. It's like having a backup generator that kicks in seamlessly when the main power flickers. But as the disease advances through its 5 stages, stage 1 being mild with a GFR around 90 or higher, all the way to stage 5 or end stage, where GFR is below 15, the symptoms start to creep in and demand attention. Ever feel inexplicably tired, like you've run a marathon when all you did was sit at your desk? That's fatigue from waste building up in your blood, a condition called uremia. Swelling or edema might show up in your ankles, feet, legs, hands, or even around your eyes and face, because your kidneys aren't removing excess fluid efficiently anymore. It's like your body turning into a water balloon that won't deflate. Notice your urine looking extra foamy or bubbly, almost like it's got detergent in it. That's often excess protein escaping, a sign things aren't filtering right. Other warning signs include persistent high blood pressure that's tough to manage with meds, because damaged kidneys can't regulate it well. You might experience nausea or vomiting, especially in the morning, loss of appetite leading to unintended weight loss, muscle cramps from electrolyte imbalances, and that frustratingly itchy skin from toxins accumulating. In advanced stages, you could see changes in urine output, either too much or too little, or even blood in the urine. Shortness of breath might occur if fluid builds up in the lungs, and cognitive fog or trouble concentrating can sneak in too. If you're dealing with any combo of these, it's worth chatting with your doc sooner rather than later. If those symptoms ring a bell, don't hit the panic button just yet, but definitely prioritize getting checked out. Early action can make all the difference. Diagnosis is straightforward and non-invasive. Your doctor will likely order a blood test to calculate your GFR using creatinine levels, a waste product from muscles, and factor in your age, sex, and other details for accuracy. Anything below 60 for 3 months or more points to CKD. They'll pair that with a urine test, often a simple spot check or a 24-hour collection, to detect albumin or other proteins. Sometimes, imaging like an ultrasound can reveal structural issues, or a kidney biopsy might be needed for a closer look at the tissue. Blood tests for electrolytes, anemia, since kidneys produce a hormone for red blood cell production, and bone health markers round out the picture. The beauty is these tests are quick, often covered by insurance, and can be done during a routine visit. Alright, so suppose you get that diagnosis. What's next? The good news is that CKD isn't a death sentence. With the right approach, you can manage it effectively and maintain a good quality of life. Treatment focuses on slowing the progression, protecting what's left of your kidney function, and addressing complications. If diabetes or high blood pressure is the driver, getting those under ironclad control is priority 1. Think medications like ACE inhibitors or ARBs that not only lower blood pressure but also shield the kidneys from further damage. For blood sugar, tight management with diet, exercise, and meds or insulin can halt the slide. You'll need to be vigilant about medications. Your doc might adjust doses or switch you off kidney-stressing ones, and always consult before popping over-the-counter pills, even seemingly harmless ones like antacids or herbal supplements. In the later stages, when kidneys are functioning at less than 15%, stage 5, options like dialysis come into play, either hemodialysis, where a machine filters your blood a few times a week, or peritoneal dialysis, which uses your abdomen's lining as a filter at home. A kidney transplant could be a game changer, offering a new lease on life from a donor, living or deceased. But even before that, treatments for symptoms like anemia, with iron supplements or EPO injections, bone disease, from phosphorus buildup, or acid-base imbalances can keep you feeling better. But here's the empowering part. A massive chunk of managing CKD happens in your daily routine, especially on your plate. Adopting a kidney-friendly diet isn't about deprivation. It's about smart swaps that support your kidneys without sacrificing flavor. Start with slashing sodium. Aim for under 2,300 mg a day, ditching those salty culprits like chips, fast food, processed meats, bacon, sausages, canned soups, and even some breads. Read labels like a detective. Hidden sodium is everywhere. Protein moderation is key too. Not eliminating it since your body needs it for repair, but choosing high-quality, lean sources like skinless chicken, fish, salmon or tuna for omega-3s, eggs, tofu, or low-fat dairy in controlled portions. Depending on your CKD stage, your doctor or a renal dietitian might advise limiting potassium, found in bananas, oranges, potatoes, tomatoes, and spinach, to prevent heart rhythm issues. Opt for lower potassium alternatives like apples, berries, cabbage, or green beans. Phosphorus control is another biggie, as high levels can weaken bones. Cut back on dairy, nuts, seeds, cola drinks, and processed foods with phosphate additives. Instead, focus on fresh veggies, whole grains like rice or pasta, and herbs for seasoning. Hydration matters hugely. Most folks aim for 8 to 10 glasses a day, but if you're in advanced stages with fluid retention, your doc might cap it. Working with a dietitian tailored to kidney health can make this feel less overwhelming and more sustainable, turning meals into allies rather than enemies. Beyond what's on your fork, your overall lifestyle is your secret weapon in the fight against CKD progression. Incorporate regular, gentle exercise. Nothing extreme, just activities like brisk walking for 30 minutes most days, swimming, easy on the joints, cycling, or yoga to boost circulation, control weight, and lower blood pressure naturally. If you're a smoker, kicking the habit is non-negotiable. Tobacco constricts blood vessels and accelerates kidney damage, so seek support through patches, counseling, or apps. Your kidneys and lungs and heart will thank you profoundly. Prioritize quality sleep, aiming for 7 to 9 hours nightly, as poor sleep can worsen blood pressure and inflammation. Stress management is crucial too, since chronic stress spikes cortisol, which isn't kidney-friendly. Try mindfulness meditation, deep breathing exercises, journaling, or hobbies like reading, gardening, or spending time in nature to unwind. Building a support network, whether family, friends, or online CKD communities, can provide emotional buoyancy and practical tips. And let's not forget the most crucial takeaway. Prevention is absolute power when it comes to CKD. Because it's so stealthy in the beginning, early detection through routine screening is your best bet for intervening before things escalate. If you have risk factors, diabetes, hypertension, obesity, heart disease, a family history of kidney issues, or even if you're over 60 or from certain ethnic backgrounds where CKD is more prevalent, like African American, Hispanic, or Native American communities, make annual checkups a staple. Those simple blood and urine tests can spot trouble when it's most manageable, potentially adding years of healthy function. Stay proactive with overall health. Keep your weight in check, eat a balanced diet low in processed junk, monitor your blood pressure at home, and get moving. Educate yourself and loved ones. Knowledge spreads, and it could save someone else's kidneys too. In the end, please treat your kidneys with the respect and TLC they deserve. They're quiet warriors, resilient powerhouses, but they're not invincible superheroes. A dash of awareness, a commitment to healthy habits, and proactive care today can safeguard these loyal friends for a vibrant, full lifetime. You've got this. Let's keep those kidneys humming.